Hi! In the last video on shoulder pain, we stopped after finishing the discussion of the physical examination. Now let's continue with the tests that your physician will be ordering to complete the process of diagnosis. A sedimentation rate for inflammation may be ordered. A sed rate is usually high in diseases that result from inflammation, such as arthritis and polymyalgia rheumatica. Polymyalgia rheumatica is an inflammatory disorder that causes muscle pain and stiffness, especially in the shoulders. Most people who develop polymyalgia rheumatica are older than 65. It rarely affects people under 50. A rheumatoid panel of tests may be ordered. This panel, consisting of a combination of tests for rheumatoid factor and anti-CCP antibodies, provides specificity for the diagnosis of rheumatoid arthritis. A serum uric acid level will also be ordered to see if gout may be the cause of the shoulder pain. Yes, you can have gout in the shoulder. The physician may also order an EKG and cardiac enzymes to see if ischemic heart disease may be the cause of the shoulder pain. Imaging studies will be ordered. A variety of imaging techniques are available for evaluating shoulder pathology. Plain radiographs or X-rays can provide useful information, particularly with a history of trauma, but they give limited information on the soft tissue structures around the shoulder. Ultrasound is an inexpensive means of assessing the biceps tendon and rotator cuff, but it has a number of limitations. Computed tomography, CT, is most helpful in the evaluation of shoulder pain and shoulder trauma, but gives limited information on soft tissues. When performed with interarticular contrast, CT can be used to evaluate shoulder instability, particularly in cases where magnetic resonance imaging, MRI, is not available or contraindicated. MRI with or without interarticular contrast is the most accurate imaging modality for evaluating shoulder pathology. It allows visualization of the soft tissues that are often the source of pain. Shoulder pain in the elderly. Shoulder pain increases as we age. The incidence of rotator cuff problems increases. The incidence of stiff shoulders due to capsulitis or inflammation of the capsule that covers the shoulder joint increase. Osteoarthritis of the joints of the shoulder increase. Again, polymyalgia rheumatica increases with age, particularly as we age over 60. Referred pain from cervical spine problems increases. And something called avascular humeral head increases with age because of the increase in humerus bone, that's upper arm bone, fractures as we age. Here, the blood supply to the head of the humerus can be cut off or reduced after a fracture of the humerus. The head of the humerus can die because of the lack of needed blood supply. When this is diagnosed, early treatment is necessary. Adhesive capsulitis. Capsulitis of the shoulder joint can be a result of trauma. The trauma does not have to be significant. It may be a slight injury, but still capsulitis can develop. It must be differentiated from rheumatoid arthritis, gout, and infection. The pain is in the shoulder and upper arm. It is usually continuous. It can occur after a fall on the shoulder or even bumping it against a wall or counter. It is sometimes called a frozen shoulder. Treatment may be steroid injections and physical therapy, but only about half of those affected regain complete movement of the joint. It may take up to 3 years to regain movement. Surgery may be an option. Polymyalgia rheumatica. In the elderly, it presents with bilateral shoulder pain and stiffness. It may follow an upper respiratory illness. The pain can radiate to the neck and upper arms. The pain can wake the patient. Activity may provide only mild relief. Morning stiffness is severe. Treatment is with steroids, but again, long-term steroid use can also be detrimental. Steroid therapy may be as long as a year. Continual follow-up and support are necessary here. The physician should also monitor the patient for other inflammatory disorders, such as temporal arteritis or giant cell arteritis. Well, I think we should end our discussion of shoulder pain here. I hope this helps. Have a good day.